Hi, my name is Bernardo Guzman, and this is my presentation on the legal issues in kinesiology for Cal Baptist University for Kin 550. We're going to start with the facility I chose. And the facility I decided to go with was related to an athletic training room for the collegiate level. After I obtain my master's, I hope to pursue a career at the collegiate level. There's a lot of misunderstanding with the day-to-day functions and practicalities done in the athletic training room, and I kind of want to go over some of those issues pertaining to the facility, legal issues, and everything else that it entails. There's a misconception of the professions as athletic trainers and what we do, other than the presumption that we put ice on people and we tape people up. So I'm hoping that I can narrow the gap with that today. Most facilities are center for athletics, where athletes can go to either prevent, rehabilitate, and maintain body performance to their specific sport, or in job specific if you're working in an industrial setting. The facility background: most of the time you're going to be dealing with some type of, hopefully you don't deal with negligence in the athletic training room. The most common problem in the athletic training room is, of course, negligence for patient care and the ability to prove whoever's at fault, whether it's the actual facility, the athletic trainer, or the policies set forth. Understanding the policies and procedures set in place to prevent being sued, fined, or loss of career. We never want to have to worry about that, but we do have to make sure that we do cover ourselves. In the case here, described by Herbert, a sophomore student out of Redwood High School, had a case against the Tampalias District regarding sporting a medical coverage provided in the state of California, and fortunately this led to negligence being proven. But I want to talk a little bit more about that and explain to everyone that we need to have a strong standard operation procedures, which are SOPs for facilities, and in this case probably wasn't generated or followed right, so probably need to focus more on that. We're going to work on the next big issue, and the biggest issue currently right now is sexual harassment pertaining to the athletic training room. Athletic trainers might face potential problems concerning sexual harassment in both the educational setting and the clinical setting, being that most programs are being turned into graduate level programs and potentially going into the PhD down the road. Again, I want to reiterate the establishment of a standard operating procedure, and will assist in preventing unwanted interactions between the athlete and athletic trainers. We deal with a lot of contact with patients, so we always want to make sure that you follow the standard operating procedures. I know the facilities that I've worked at in the past, usually when you're working with females, you have more than one female present in the facility, in the medical training room, in the exam room. Basically, you want to always make sure that you're covering yourself. Basically, sexual harassment can occur in any variety of circumstances, including but not limited to the following. Men as well as women can be victims of sexual harassment. Same-gender sexual harassment can be the victim's supervisor, a coworker, an agent of the employer, or supervisor in any other area, a non-employee, or even a student. Victim does not have to be the person harassed, but could be anyone affected by the offense conducted toward another. Again, this kind of goes into, you can lead to financial injury, dismissal of the victim. Conduct and behavior must be anything that's not unwelcomed is basically harassment. So you always want to make sure you take care of yourself and making sure that you're following the guidelines set forth by the SOP. The next thing is probably the biggest concern, aside from the legality, is prevention of pathogens in the athletic training room. And this is big risk management, because when you have a large body of people, in particular athletes, they spend a lot of time together and they spend a lot of interaction with one another. So the risk of spreading disease, illness can increase and amplifies when there's more than one person or teams involved. A role of the athletic trainer is to prevent the risk of an injury or illness and to ensure the safety of the athletes and employees. Bloodborne pathogens and infections can spread very easy when people are in a constant contact with one another. Kind of goes with during the field of play, kind of anything like that. So as an athletic trainer, the implementations and protocols to be used by every individual who comes into contact with MRSA. This is a case involving MRSA, one of the easiest and most commonly spread things in a facility if proper hygiene isn't taken. These guidelines are set forth for prevention, treatment, and control of MRSA, and should be developed and include educational materials for athletic trainers that describe infection control methods and measures to respond in the case of infection outbreaks when they occur. Gotcha. Again, you always want to make sure you follow your operating procedures when it comes to hygiene, and you want to make sure that you don't get anyone sick. Again, that leads to the last slide and possibilities of being sued, loss of job, loss of employment, and basically changing the whole protocol of your athletic department. The next big concern that I thought was big for risk management is the management of prescription medications in the athletic training room. Most facilities at the collegiate level do have a medical exam room which has prescription or over-the-counters, in which case you always want to make sure that you have them locked. Two doors have to be locked at the same time, and you always want to make sure that you're noting everything being given out to an athlete, anyone that comes into that facility asking for over-the-counters or prescription medicine. The problem across the country is that the concern of professional teams, private universities, and colleges with the inappropriate handling of prescription and over-the-counter medications. Going off of what Nichols said, as a certified athletic trainer, an athletic training room, also referred to as an athletic training medical office, it is vital that all facilities implement policies and procedures to help manage the handling and prescription medications. State and federal regulations are applicable depending on which state you're in. And at the same time, you want to make sure that your facility has an inventory of a single medication or the entire team physician. You want to always make sure you have everything noted down. As far as employment loss, I decided to focus on the understanding and the hiring of athletic trainers in secondary schools. In order to understand the issues related to hiring and firing, equal pay, discrimination, the opportunity to have a job needs to be the priority in order to determine the employee rights. So, right here is understanding separating medical professions, whether it's an EMT, whether it's an ATC, whether it's a PT. Understanding what the role of an athletic trainer is and not putting him or her in a position that will lead them to not working within their scope of practice. So in this document noted here, it talked about how coaches were being seen as the lead first aid responder that had no medical training, and it kind of went into the more rural areas of the county, and where athletic trainers, medical professionals weren't able to have access to providing care for the athletes, and they deemed it safe for coaches to do that, and nowadays that doesn't work. You're asking for something to happen. Again, we're in a very male-dominated profession, unfortunately, as stated by the data sheets that were provided to us a few weeks back now. Female athletic trainers face barriers in employment within the profession. Although there is evidence for an increasing percentage of women in athletic training, the portion providing medical care to male sport teams within the profession, sport, and collegiate setting continues to be small. I stated this in a paper for the class that there is an athletic trainer, the head athletic trainer for the Los Angeles Dodgers. I live in Los Angeles currently. That's too small to have only one person, and to make that big of a deal, having a female athletic trainer represent a male-dominated sport. So I do believe there needs to be change for that. How that's to be determined still. The factors of this, according to the document, the factors that played a role in women gaining employment in these male-dominated sports teams basically determine their pre-existing professional relationships, prior experience in the male sport, and perseverance. So women aren't being hired based off of their educational experience, based off of their work experience. They're using the resources that they've connected throughout their time as an employment, and that's basically it. So that is a concern, because there are a lot of very smart, very powerful female athletic trainers. So yeah, we're going to continue moving forward with that, and we're going to go into the proper hiring of athletic trainers. And we want to understand what the requirements and the demands of the profession of athletic training generates and expectations for everyone wanting to pursue the career. So employers need to create a sound job description and requirements so that there isn't any misconceptions or biases that can lead to possible legal actions against the employer for discrimination. So Day set forth 5 attributes related to the proper hiring of an athletic trainer, which I tend to agree with. Based off your work history, your job experience, your work ethic, communication, and interpersonal skills, because you're dealing with people every day and you want to make sure that you're taking care of them. We're going to go into touch base lastly about the faith and application of this. And I have a saying here that says basically you're commit to the Lord whatever you do and He will establish your plans. Now, this kind of goes forth into the encompassing of creating a plan and everything you do, whether big or small. And that kind of goes back to creating an SOP, creating your developmental program, sound program for your facility and for your whole career. And you want to make sure that none of those steps hurt you, and you always want to make sure someone reiterates and follows that whole process. So biggest things that came out of me from the class, the outcomes of this class, is we were able to see the big picture, and I enjoyed the process and the layout the class painted, and being able to connect all 3 of these big topics allowed me to kind of step back and look at what I possibly need to work on if I decide to, maybe establish my own place of business when there's certification and licensing in the state of California. Understanding what we need to do just in case we ever put in a certain situation, if we're dealing with the legal situation. I don't ever want to, but it's good. It's a good idea to have read and understand what I may or may not have to do in the case that I have to present myself or defend myself. So I thank you for that. And last but not least, these are my references. And again, thank you for your time and have a good day.